We've gotten to know Onondaga County's health commissioner at the county executives briefings, but Dr. Indu Gupta is the first to remind us she represents a team of more than 200 working to protect the public's health. News Channel 9's Andrew Donovan takes us inside the health department where the work is more essential than ever.
This is Wendy with the Onondaga County Health Department.
When Wendy Karlowitz walks into work, she's one of the first to see the coronavirus test results just in.
We noticed that through lab confirmation that you have tested positive for the COVID virus.
What's it like to call someone and tell them you tested positive?
You know, I'm always a little apprehensive that they don't know that I'm the first line, and a lot of times I think they know.
As a registered nurse, she's temporarily moved from the Office of Environmental Health, focusing on mosquitoes and algae, to the front lines of coronavirus.
The one conversation I remember is one gentleman that just thanked me for, I guess it was my soothing voice and just how I talked to him through the investigation. You know, at the end of the day, he said, "It was really great to talk to you. You've made me feel better. You've made me understand what's going on in the community, what my responsibilities are," and I still remember that guy. So that makes me feel good.
In order to protect private patient information, Karlowitz shows us what one of these phone calls would look like.
So at this time, you're going to be put under a mandatory isolation.
After telling the patient about their legal commitment to quarantine, she then asks for a list of everyone he or she came into contact with the weeks prior who will likely get the same order to stay home.
Somebody who may not have maintained the greatest social distancing and could have went to work when they were asymptomatic, when they probably should have stayed home. That list can go from 5 people up to 15, and those are, you're contacting 15 people at that. So it can take hours, truthfully, for one case.
That times almost 400 cases now, which is why this staff is working long hours, 7 days a week. Because it's mostly confidential work, it's hard to vent or find support outside the office.
No one knows what happens here. You know, nobody can really understand, and then you sort of don't want to talk about it when you go home. But, you know, we have each other to lean on.
Their sacrifice allows us to lean on them. In Syracuse, Andrew Donovan, News Channel 9.
The health department stays in touch with the patients throughout their 14-day quarantine and has to approve them for release from it. The nurses also ask their patients if they need any basic supplies like face masks, hand sanitizer, or thermometers for daily temperature checks, which are then delivered by the health department.